Hello everyone, I am Mrs. Deepika Sri from the Department of Physician Assistant in Allied Health Sciences. Today I am going to explain about the treatment goals for fractures. If the fracture may occur, already I explained about in different videos like the definition of the fracture and causes and mechanism of injury and types of fracture, classifications of fracture and investigated methods of fracture. We can saw that videos, and now this video is about the full on treatment goal. In treatment goal, the goal of treatment is to put the pieces of bone back in place, control the pain, give the bone time to heal. These are the main important goals during the treatment. First thing is we can put the pieces of bones into normal positions, means we can to get back from the bones as a normal positions. Another one is control the pain, which means the patient getting the more pain during the traumatic time, so we should manage the pain. And another one is give the bone time to heal. The bone get healing. It can get healing by the different stages, and the prevention of any other complications like infections. And another one is restore normal use of the fractured area. So this is the main important three goals about the fractures. Now we are moving to the medication management. In medication management, we have to give analgesics for the patients. And another one to improve the bone getting healed means split and cast. In this video, this is called split. This is called a split, and this black color one is called a cast. The immobilizing the injury or to keep the bone is alignment. If the bone get injured means we should not get the bone moved, because the alignment will change and we can't able to do the normal work like past. So we have to align the bones in a normal position. So we have to put some braces, means like a split or cast. So immobilize the injury area to keep the bone is aligned. It protects the injured area from motion or use while the bone heals. It protects the injured area to get moves, overloaded movement, or use while the bones heals. So this is the main important reason to wear split or cast. So another one is traction. In traction, it is the usage of the steady pulling action to stretch certain part of the body in a certain directions. It is called traction. It is done by orthopedicians or physiotherapists. So the traction often uses pulleys, strings, weights and a metal frame attached over or on the bed. The purpose of traction is to stretch the muscles and tendons around the broken bone to help the bone ends to align and heal. So this is the two main important reasons. First thing is to help the bone to heal, and it is gets the good alignment like before. So this is the major reason to get the patient for traction. It is the muscle stretching method which can build on the cord of the patient itself. It gives more good alignment, which means good posture, and to enhance the healing process of the broken bone. Another method is the surgery. The surgical method, during the surgery, they may need a put of certain type of broken bones back into the place. Occasionally, internal fixations and external fixations also needs. The medical healthcare provider sayings O or IF means open reduction internal fixations. Open reduction internal fixations is O or IF, and E or IF means external reduction and internal fixations. What are the external reduction means like traction, and the internal reductions denote some metal rods, pins located inside the bones. Using the pin, plate, screw and some rods for making the bone good alignment for the fractured side. So the orthopedicians are using to use the plates. This one is called as plates. This one is called as plates, and this one is intramedullary rod. to get a bone to stand in a good position. So this is the metal rod, and another one is pin. Using the pin, it can screw into the some. It is it is the actually the acetabulum followed by blockage of this femur. So this is using some the internal fixation for the patients, those who are getting the fracture. So these are the three techniques. First one is the surgical, means we are using some rods, plates and some pins. Another one is for the split or cast. Another one is the traction. These are the three main things to use for the fractured patients. Thank you all.